Hey Mason families, it's Jonathan Cooper, and for our weekly update this week, we have all kinds of good information for you to understand as families and to share with others. So if you could watch through this entire presentation, I think it'll be very helpful in answering some of the common questions that we've heard out there this week. So one of the things I want to talk about is as we move from quarter one into quarter two, we know we asked you recently to make some decisions, and the decision was whether you're staying in your current setup and in-person learning or online learning, or you're making a switch as a family. And so we had about 500 requests to make a switch, and 80% of those requests were going from online learning to in-person learning. And then obviously 20% of the folks that were in that 500 requests are moving to an online learning option as they go into second semester. As we continue to learn more as a community about coronavirus and about the data, and as we asked families to make a decision about second semester, we did get some very helpful feedback from our community, and one of the pieces of feedback or themes was that people were concerned about what data are we using to make our decisions, whether we're going to be in person or hybrid or going to full remote. And as you know, back in July when I was giving presentations to the board, we only had one tool. We had the color code system for the counties, and so that was a tool that we were really leaning on. As we have learned more with the experts around us, whether it's our local health department, the state health department, or the local experts in our area, we have actually built more tools to use. So we have more tools to look at to make decisions so that we can be more specific to our local community data. And so that's why we've invited our partners from Warren County Health Department today to talk a little bit about what the county color code system really means and what it is, and then we can talk more about how we're using specific data within our school to make those decisions so that we are always making safe decisions for all of our families. We're so fortunate to have great partners in our community, and one of the partners that we lean on daily and probably multiple times a day is our local health department in Warren County. And we're fortunate today to have Dustin Ratliff, who is emergency coordinator for the whole county. And we also have Dwayne Stansberry, who we work with, who's the commissioner of Warren County Health Department, who couldn't be here today. But these are people we work with every day. They are amazing partners. They help us to connect with state resources. They help us connect with the proper PPE that we need in our district to keep our staff and our students safe. And they have helped us all the way through the summer in the planning process to open our schools with the proper protocols to make sure that we are aligning with science and data to keep all of our communities safe. So I'd like to introduce Dustin and have him share a little bit about some of the things that they're seeing.
Thank you, Jonathan. I'm glad to have this opportunity to talk to the Mason City Schools community today. And I again want to compliment Jonathan and your whole team here. I think that working with you, the other superintendents in the county, I think we've developed some best practices for those collaborations that we can do as we move through the response to the coronavirus pandemic. The Ohio Public Health Alert System is designed to be an early warning system as we are moving through the coronavirus pandemic to look at what's happening in our counties throughout the state. There are multiple indicators that are included in the alert system, including the rate of new cases, having the increase in the daily number of cases, having increases in outpatient visits, the number of cases that we have that are happening in congregate care facilities, also the information that we have for people that are going to emergency rooms, the number of hospitalizations, and then finally, the actual capacity that we have of our hospitals throughout the region. And again, as an early alert system, the entire point of this is for us to be able to look at the indicators and know when there might be something that's turning and changing in the actual pandemic. And as our county in Warren County moved from the orange designation to the red, we were hitting some additional indicators, and the one that we had not hit before was the number of outpatient visits. And what we saw as we hit all four of these indicators was it did predict an increase in cases. Just a few days after that, we had the day that we had the highest number of reported cases, and we've continued on that upward trajectory. So it appears that the system, especially here in Warren County, worked as intended. And we're seeing that across the state, and especially Southwest Ohio and West Central Ohio, as we have moved from having less counties being red to moving to more counties being red. we're seeing those indications that this alert system did allow us to start getting our ducks in a row, working with our partners, and being able to change some of our processes to be able to respond as we move forward. As we have discussed with our local partners, the governor has discussed it, the director of health at the state level has discussed it, we are not currently seeing evidence of significant spread in our school settings when we have these controlled environments where we have these experienced educators, we have all the professionals that are looking at the recommendations that have come from our office, from the state, from the federal level, to put in these mitigation measures in our schools to limit the risk of the spread of COVID. And what we have been closely monitoring is just that, and seeing if we're seeing the secondary cases that are coming when we would have an individual case and those individuals that would have been close contacts of the case. And as of right now, and we're seeing this across the state, we're not seeing the direct evidence of that spread occurring in our schools. In Warren County and across the nation, a lot of the spread that we are seeing are actually in these gatherings that would be at people's houses, where they might be having their friends together, maybe their family, and you're letting your guard down when you're more likely to have close contact. We're seeing it in those settings. We are seeing it as we have throughout the pandemic, when a family member is diagnosed and is a case has COVID, that it can spread in that family unit, in that household. Again, as I said, we're not seeing significant evidence of it occurring in the school settings where they're highly controlled, nor in the businesses that are using the safeguards and the measures that have been put into place to try to limit the spread in there. However, businesses that have maybe laxed on utilizing those measures, we are seeing spread in those situations. So contact tracing is one of the few tools in the toolbox that we really have to be able to mitigate the spread of the SARS-CoV-2 virus in our community. And what contact tracing is, it's something that we have done in public health forever, where you have a case where you have an individual that actually has the virus, has the disease, and then you identify who are those close contacts. And for COVID-19, those close contacts are individuals that have been closer than 6 feet for 15 minutes or more with a case. And then through the disease investigation process, when we have a reported case, then we are working with that case to identify who those close contacts are so we can notify them that they are a close contact and need to quarantine for 14 days. And in the school settings, we are working hand in hand with our experienced school nurses to be able to identify those students that are close contacts so that we can make sure that they go through the appropriate quarantine to limit the spread of disease. As we've moved from orange to red, our recommendations to the public for the public health mitigation efforts haven't changed. We do have some tools, again, in our toolbox that we can utilize to reduce the risk of spreading the SARS-CoV-2 virus. One is social distancing, making sure that you are maintaining those 6 feet away from one another when it's possible. Washing your hands frequently. Making sure that when you are sick, that you are not going to work or school, that you're seeking the appropriate medical care, and if it's indicated that you have the signs and symptoms of COVID-19, that you're getting a test so that we can know. And also, very importantly, we have a mask. We have more and more scientific evidence suggesting that by wearing a mask, we can limit the spread and limit the additional people that will get the COVID-19 disease. And by doing that, we can limit the number of people that will have severe disease. And that's what we're trying to do. We're trying to limit the spread of this to limit people getting COVID and being seriously ill. The first thing to consider is that this is a COVID year for everyone. It's incredibly difficult for all of us. For us at the health district, for our experienced educators at Mason City Schools, and for each and every one of you at home. As Jonathan has already indicated, there have been people that have had to make those very difficult decisions. Is my son or daughter going to go in person, or are they going to do the online learning? And what we have to understand, especially as a community, is that there is no perfect answer for everybody. It's very difficult for us to make those decisions, and as we're moving into the holiday months, those decisions to have family get-togethers are going to be extremely difficult. There's not a one-size-fits-all approach. Again, as I've indicated, what we are seeing are when we have the identified areas where there is the spread of the SARS-CoV-2 virus, it's when people are in those close contact situations and are letting their guard down. So it's something for each and every one of our families in Mason to consider and really look at what is going to be the best for you.
I would like to take a second to thank Dustin for being here today and thank Warren County and all of their partnership through this whole process. I can't tell you enough that the Warren County Health Department, we're actually on phone calls daily and multiple times a day. We probably drive them nuts, texting them in the evening, talking on the weekend. But we take quarantining, we take COVID-19 seriously, and so we lean on our experts to help us through that, and they have been excellent. And so as you've heard some great messages from Dustin today, I hope you take those and share those with your friends and your neighbors, because they're helpful guidance and helpful advice. And as I mentioned, quarantine. You know, quarantine is a big conversation. It's a national conversation right now. So if you look in the papers, they're talking about, is there spread in school settings or is there not spread? And right now the evidence would say that they're not seeing spread in school settings. And so we are also in that conversation nationally, and we're trying to understand that. So if the quarantining process, which we take very seriously, if we're over quarantining students and sending them home and they don't have COVID-19 and they're not asymptomatic and they're not symptomatic, is there a way to have them back in person if they've chosen to be in person? Because we know that there's layers to the health of a child. It's not just COVID-19, but it's their mental health. So we are working in collaboration with the health department regularly on this conversation. We're actually working with the state health department as well. So Lance Himes, the director of health here at the state, has been a great listener in this process. He's actually called and listened to our situation and tried to understand the data. He had Dwayne Stansberry, the commissioner, and myself on a phone call to talk through, what are you seeing? If we added some rapid tests to this protocol, could we gather more data? Because the governor would like to have more data before changing anything in quarantine. And we applaud him for being data-driven and scientifically driven in this process. That is something we should all be doing together. So as we look into this possible protocol coming out, we will inform you. We'll share more information, because that could be something that we can look at together as a community to begin making sure that as we look at quarantine, we're taking it serious, but we're also not over quarantining and sending kids home, because it is a huge burden on the system that we must understand. Our teachers, when they are teaching in person and then they have 15 kids out here that are in quarantine, that's challenging. Now, if those quarantines are necessary, we want to do that. But if for some reason there's data that shows that that's over quarantining kids and sending kids home without symptoms or asymptomatic, we want to make sure that we address that appropriately. As we close out this week's update, I want to just reinforce a couple messages you've heard through this update. Number one, this is a serious situation that we're in. COVID-19 is serious for all of us. It impacts our family just as much as everyone else's family. And as a father in this community, I want to share something with you. As we make decisions, we take that serious. And as we make decisions about our kids' safety, I am always thinking through the lens not only of your kids, but my own kids. I have 4 kiddos in the school system, and we have chosen in-person learning. And I have 1 kiddo that has a compromised immune system, and so we take that very serious. It's not something that we take lightly as a leadership team. It's not something we take lightly personally as a Cooper family as we make decisions. So as you are thinking through your situation, as you're thinking through our community, this is a moment where we do need to come together. There is so much division in our world, and we all see that in social media. We see that everywhere. And I'm asking each of you to take part, to come together, to bring our community together. We are one Mason. This is not an online Mason and an in-person Mason. Yes, we have made different personal choices, and I respect that, and I hope all of us can respect our personal choices. But we are one Mason, and we're one community. And there is no way that we will make it through this unless we pull together. So I'm asking all of us, if you're hearing this message and you know others are not, please share this message with others. Make sure that we are spreading accuracy. Make sure that we are coming together and that we're working together to be stronger at the end of this as we come through this. Thanks again for tuning in this week, and we'll be back next week with more updates.